Good morning, everyone! I am Donna Rose Bibugarin.
I am Ara Joyce Bautista. We are the Group 2.
And our topic is all about importance of an active lifestyle. So let's proceed to our lesson.
Living an active life is important to staying healthy. Staying active helps to reduce your risk of conditions like heart disease, diabetes, and stroke. Exercise has also been linked to improve mental health and cognitive function. You don't have to be a distance runner to improve your health. The most important thing is that you're staying active. Regular moderate to high intensity of physical activity and exercise was proven to improve overall health and fitness. An active lifestyle can improve bone, joint, and muscle strength. It develops motor control and coordination. It helps to maintain a healthy body composition. It improves the psychological functioning of an individual. It increases the efficiency of the lungs and the heart. It increases muscle strength and endurance. Protects from musculoskeletal problems such as low back pain. It possibly delays the aging process. Reduces the risk of cardiovascular diseases such as coronary artery disease and stroke. Promotes healthy cholesterol level. Helps regulate blood pressure. Decreases risk of type 2 diabetes. Reduces the risk of breast and colon cancer. Improves control over anxiety and depression. Builds self-esteem and social interaction. What changes or adaptations will occur as a result of aerobic exercise? A regular aerobic exercise will stimulate changes in the various organs and tissues of the body, but is more emphasized in the cardiovascular system. These changes help the body adapt to the increased demands by allowing more oxygen and nutrients to the exercising muscles. Moreover, the muscles are able to extract more oxygen from the blood, which translates to an increased maximum amount of oxygen that the body can utilize. The adaptations that lead to an increase in max are due to the changes that happen in the heart, blood vessels, blood, and muscles. One of the biggest changes happen in the heart, wherein it is able to eject more blood at every beat as a result of an increase in the size of left ventricle chamber. Moreover, the muscle that covers the left ventricle of the heart becomes thicker due to aerobic training. Thicker muscle wall can generate more force at each contraction, enabling it to expel more blood out of the chamber. Another important adaptation of the cardiovascular system to aerobic exercise is an enhanced capillary network toward the working muscles. The capillaries are the smallest blood vessels where exchange of gases take place. This adaptation maximizes the ability of the cardiovascular system to deliver oxygen and nutrients in the entire body. Another set of adaptation happens in the blood. There is an increase in plasma volume within 2 weeks of aerobic training. These adaptations helps improve blood flow to working muscles as well as regulates temperature during exercise. In addition, it enables the body to increase its ability to transport oxygen because more oxygen-carrying red blood cells are produced. Is it normal for the muscles to increase in size as a result of resistance training?
The adaptation of the body to regular resistance exercise is commonly found in the nervous and the musculoskeletal system. The neutral changes help in activating more muscle during movement. the musculoskeletal structures adapt to increase force production capacity and resist fatigue. This adaptation happened at the cellular level after several months of regular training. The primary adaptations from resistance training is an increased stability of the muscle to generate force or strength. This is made possible by an increase in muscles fiber size of hypertrophy that commonly starts after 2 months of resistance exercise. The increase in muscles fiber size occurs as more contractile elements and fuel stores are deposited inside the muscle cell. Evidence shows a possibility of an increased number of muscle fibers or hyperplasia as a result of resistance training. The tissues surrounding the muscles also strengthen in order to resist injury. The connective tissues, just as tendons and ligaments, are able to withstand the greater forces produced by the hypertrophied muscles. Moreover, the mineral content of the bone increases in response to increased muscle strength.
How important is stretching exercise in improving performance?
Stretching exercises are important in improving range of motions around the joints. It helps an individual in performing daily tasks with efficiency. The evidence effects of stretching exercise are felt with an athlete suffers an injury or when a person gets older, when the joint condition deteriorates as a result of injury or aging. The muscles surrounding the joint lose elasticity, leading to stiffness. Joint stiffness makes an ordinary movement such as raising the arm difficult and painful. Additionally, joint stiffness increases the risk of re-injury during sports competition. As the limb is moved to its entire range of motion, the muscle tendon units get stretched. The muscle tendon unit has an elastic property that enables it to return to its original shape or length. When the stretching exercise is performed over and over again, it no longer completely returns to its original length, allowing it to react to the load more effectively and initiate a more fluid movement. Exercises that address the flexibility of a joint will improve muscle coordination, connective tissue elasticity, and overall joint strength. As the joint moves in the three-dimensional space, muscle must be activated in the proper sequence and correct strength. Flexibility training improves the efficiencies of movements. Furthermore, the increased elasticities of the muscles and surroundings connectivity tissues increases the range of movement without resulting to injury. A regular stretching routine will also help correct muscle imbalance and improper posture.
Why is it hard to change unhealthy habits?
Healthy behavior are hard to adapt. Unhealthy behavior has to be consistently and consciously performed to kick out the old habit. Habits are behavioral patterns that are performed unconsciously. They are hard to break because the brain had been programmed to make the behavior or action part of its default setting. Changing an old habit is an arduous task, but not an impossible one. The first step is to recognize the practice of an healthy habit that goes beyond knowledge of its existence. Most smokers are aware that smoking is bad for their health, and yet the negative behavior persists. It should be a personal and conscious decision that the old habit is detrimental to one's health.
This decision is a big obstacle to hurdle before an individual moves to the next stage of change. According to the trans-theoretical model, a person remains in the first stage or pre-contemplation stage if he or she does not recognize the presence of an unhealthy habit and the importance of changing his and her behavior. Once the individual becomes dedicated to the idea of adopting a positive behavior, he or she enters the next stage of change, which is the contemplation stage. For example, many smokers know that smoking is a risk factor for lung cancer and other diseases. They remain in the pre-contemplation stage by knowing this. But when one of their loved ones who is also a smoker is diagnosed with lung cancer, they will start to think whether it is time to give up the habit. It is during this time that they move to the contemplation stage.
The third stage is called preparation stage. Once an individual is convinced to make the change, he or she starts to prepare for the actual date and time to start the new behavior. The preparations might include setting a date on a calendar or planner, telling family and friends about the new behavior, and asking help from friends who made the change. The fourth stage is the action stage, which is the day the individual initiates the new behavior. According to research, a new behavior has to be consistently performed for at least 6 months before it becomes part of the system. The action stage mirrors these durations during this time. The individual might be tempted to practice his or her old habits. The temptation to backslide is greatest during this stage. The next stage occurs when the individual has consistently practiced the new behavior for more than 6 months, called the maintenance stage, where the tendency to backslide to old habits is minimal.